Welcome to Longevity Secrets, where we explore vital health knowledge you might not have heard before. Today, we're diving deep into an essential yet often overlooked topic: your bone health. Every year, millions of us, especially after, focus on staying active, eating well, and trying to keep our bones strong. We drink our milk, take our calcium, and think we're doing everything right. We often consider our bones a strong foundation for an active, independent life. What if you knew that some common daily habits, regular medications, or even overlooked health conditions might be quietly weakening your bones, putting you at a high risk for fractures and a loss of independence? It sounds surprising, doesn't it? You trust the advice you hear, you follow every recommendation. But buried in the routines of modern life are silent risks that no one warns you about. Not the breaking news, not the wellness blogs, and sometimes not even your doctor has time to alert you. Imagine living an active life, thinking your bones are solid, only to suffer a sudden fracture from a minor fall, leading to pain, dependency, and a long recovery. You're left wondering, what just happened? Here's the truth: certain daily practices, medications, or even overlooked health conditions may quietly accelerate bone loss, disrupt calcium absorption, and set off a chain reaction that can lead to brittle bones. This isn't here to scare you. The purpose of this video is to empower you with knowledge, so you can ask better questions, make more informed decisions, and truly protect yourself and your loved ones from these potential hidden risks. Because after, bone care isn't just about building strong bones, it's about avoiding the things we might accidentally cause that could dismantle this crucial foundation. In the next minutes, we'll uncover 5 common factors, habits, or conditions often overlooked that may carry hidden bone risks, especially for those over. And more importantly, you'll learn exactly how to protect yourself before your next appointment. If you're over and concerned about your bone health, drop a in the comments below. If not, drop a, and be sure to subscribe to Longevity Secrets, where we always seek out and share health truths others might not tell you. Now, let's talk about the first surprising factor you should think twice about. Factor 1: over-reliance on proton pump inhibitors, PIS. We'll start with a very common class of medication, prescribed millions of times each year: proton pump inhibitors, or PIS. You might be familiar with names like omeprazole, Prilosec, lansoprazole, Prevacid, esomeprazole, Nexium. They're quick saviors for heartburn, acid reflux, and stomach ulcers. They work by significantly reducing the amount of acid in your stomach, bringing rapid relief. Sounds perfect, right? But here's what many seniors are never fully told. While they effectively tackle heartburn, these medications can quietly put significant stress on your bone health, especially if you're over and taking them long-term. Mechanism of action. Let's understand how they impact bones. Stomach acid plays an incredibly crucial role not just in digesting food, but also in the absorption of essential minerals vital for bones. These are calcium and magnesium. When stomach acid is excessively suppressed by PIS, your body's ability to absorb these minerals from your gut is significantly impaired. This means that no matter how much calcium-rich food you eat or supplements you take, your body simply can't effectively utilize them to build and maintain bone. Over time, your body will start drawing calcium from your very own bones to maintain other critical functions, leading to silent bone loss and gradual weakening. Scientific evidence and real-life stories. Scientific research has provided concerning evidence. A study published in the British Medical Journal BENS indicated that long-term PI use, typically more than 1 year, was significantly associated with an increased risk of hip, wrist, and spine fractures in older adults. Notably, those with other existing osteoporosis risk factors were even more vulnerable. This isn't just dry statistics. Take the case of Miss May. She had been taking omeprazole daily for over 3 years to manage chronic heartburn. She was active and tried to maintain a healthy diet. However, when she went for a DEXA scan to check her bone density, the results were startling: significant osteoporosis. Her doctors believe that the prolonged PI use severely hindered her calcium absorption, contributing substantially to her bone loss. Warning signs and self-protection. So how do you know if PIS might be affecting your bones? If you've been on PIS for many months or years, especially if you're over and have other osteoporosis risk factors, family history, sedentary lifestyle, vitamin D deficiency, it's time to reevaluate. This doesn't mean PIS are bad. They can be life-saving in severe cases like ulcers or Barrett's esophagus. But the key point is, they should be used wisely at the lowest effective dose, and for the shortest possible duration. Questions you should ask your doctor. Before continuing long-term PI use, don't hesitate to ask your doctor. Is this medication truly essential for my condition right now, or are there safer, short-term, or alternative treatments available? Can we try to gradually reduce the dose or discontinue the medication? Are there non-pharmacological solutions to manage my symptoms, such as dietary changes, lifestyle modifications, or milder antacids? Do I need a bone density test, or vitamin and magnesium level checks, especially if I've been on PIS for a while? Remember, sometimes a simple dietary adjustment, avoiding trigger foods, eating smaller meals, not eating close to bedtime, or a milder antacid can provide enough relief without the added risk to your bones. Be proactive in protecting your bone health. Factor 2. Excessive unmonitored exercise or high-impact activity. Next, let's talk about something most of us consider universally beneficial: exercise. We all know that physical activity is key to maintaining health. It helps with weight management, boosts cardiovascular health, and certainly contributes to stronger bones. On paper, working out hard, sweating it out, and pushing your body to its limits sounds like a smart move. But here's what many people, especially often don't realize. If you're unmonitored or engaging in high-impact activities without properly assessing your bone status, some simple exercises can actually turn risky, even damaging to your bones. Understanding bone stress. While bones need remodeling through stress to become stronger, which is why weight-bearing exercises are crucial, excessive or improper stress can be counterproductive. In high-impact activities like prolonged intense running on hard surfaces, excessive jumping, or heavy weightlifting without proper form, your bones and joints are subjected to significant forces. For bones that are already thinning, like in osteopenia or osteoporosis, this can be akin to applying too much force to an already delicate structure. Potential risks and evidence. The main risks include stress fractures, tiny hairline cracks in the bone caused by repetitive strain. These frequently occur in the feet, shins, or hips. Additionally, Overexercising can accelerate cartilage wear and tear, leading to chronic joint pain and reduced mobility. A study published in the Journal of Bone and Mineral Research looked at older adults engaging in very high-intensity or unaccustomed high-impact exercise without prior assessment of bone density. The results showed a significantly higher incidence of stress-related injuries, particularly among those with early signs of osteopenia. A cautionary tale. Hear the story of Mr. and a very enthusiastic fitness enthusiast. He decided to join a new, intense CrossFit routine without checking his bone status or consulting a specialist. After a few weeks of pushing himself hard, he developed severe foot pain. Doctors eventually diagnosed him with a stress fracture in his metatarsal bones. And realized that while exercise is good, knowing his body's limits and seeking professional advice on appropriate intensity and type of exercise would have saved him considerable pain and recovery time. Advice and self-protection. This doesn't mean you should avoid exercise. On the contrary, exercise is critically important. But for seniors, the type and intensity of exercise matter immensely. Questions you should ask professionals before starting any new exercise program, especially if you've been sedentary for a while or have any bone health concerns. Consult your doctor, a physical therapist, or a certified personal trainer experienced with older adults. Ask, what types of exercise are safest and most effective for my bone health at my age and current fitness level? Focus on weight-bearing but low-impact activities like brisk walking, stair climbing, tai chi, or yoga. Incorporate strength training with light weights, resistance bands, or body weight to build muscle that supports your bones. If you're experiencing persistent aches, swelling, or pain that worsens with activity, these could be warning signs of stress fractures. Don't ignore them. Seek medical attention. Always listen to your body. Start slowly and increase intensity gradually. Remember, the goal is to build stronger bones safely, not to cause damage. Factor 3. Unrecognized vitamin deficiency. Now, let's talk about something that's become incredibly routine, especially after taking vitamin supplements. We hear a lot about vitamin D, and many of us assume we're getting enough, or that a single multivitamin covers all our needs. But here's what many people, particularly after, might not know: if your vitamin D levels are truly deficient, or if your body isn't absorbing it properly, it might be doing more harm than good to your bones, even if you're diligently taking calcium. The crucial role of vitamin D. Think of vitamin D as the gatekeeper for calcium. No matter how much calcium-rich food you eat like dairy, leafy greens, or how many calcium supplements you take, without sufficient vitamin D, your body simply cannot effectively absorb calcium from your gut into your bloodstream. This means calcium can't be transported to your bones to perform its building and repair duties, leading to gradual bone weakening and brittleness. Why are seniors at higher risk of deficiency? After, your skin's ability to synthesize vitamin D from sunlight naturally declines. Furthermore, spending more time indoors, using sunscreen, and certain medications can also hinder natural vitamin D production. Dietary sources of vitamin D like fatty fish, egg yolks, fortified foods are often insufficient to meet daily requirements, especially as the body's absorption capabilities may also decrease. Scientific evidence and real-life stories. A large-scale review published in the Journal of the American Geriatrics Society indicated that among older patients with recurrent fractures, a significant percentage had undiagnosed or undertreated vitamin D deficiency. Sadly, many of these patients, despite taking generic calcium supplements, continued to experience bone loss because the critical factor was missing. Let's tell the story of Miss Ma. She diligently took a daily multivitamin that included vitamin D. Yet after a seemingly minor fall resulted in a hip fracture, her doctors tested her and discovered her vitamin D levels were critically low. They believed her existing deficiency, coupled with her body's reduced ability to utilize the standard supplement dose, made her bones exceptionally fragile. Warning signs and self-protection. Symptoms of vitamin D deficiency can be subtle and easily confused with other age-related conditions: persistent fatigue, bone aches, muscle weakness, and mood disturbances. This makes diagnosis difficult without testing. Questions you should ask your doctor and how you can protect yourself. Don't just assume you're getting enough vitamin D or self-prescribe without knowing your levels. Ask your doctor, can we test my blood vitamin D levels? A simple blood test hydroxyvitamin D can accurately determine your status. If your levels are low, discuss a targeted supplementation plan with your doctor, which might involve higher doses for a period or different forms of vitamin D that are more readily absorbed. Ask about the optimal vitamin D level for you, not just general recommendations. Consider safe sun exposure around minutes daily in early morning or late afternoon, depending on skin type and geographical location, but always be mindful of skin cancer risks. Familiarize yourself with vitamin-rich foods to incorporate into your daily diet. Remember, vitamin D is the key for calcium to enter your bones. Don't let an unrecognized deficiency undermine this crucial foundation. Factor 4. Chronic uncontrolled inflammation. Our fourth factor to consider is a silent enemy: chronic inflammation. We often think of inflammation as the body's short-term response to injury or infection. But when inflammation becomes chronic, lingering for weeks, months, or even years, it can wreak profound damage on various body systems, including your bones. The link between inflammation and bone health. Chronic inflammation, often without overt symptoms, can stem from various sources: autoimmune diseases like rheumatoid arthritis, inflammatory bowel diseases, Crohn's, ulcerative colitis, persistent infections, or even an unhealthy lifestyle, a diet high in refined sugars and unhealthy fats, lack of sleep, chronic stress. At its core, our bones are constantly undergoing a remodeling process. Cells called osteoclasts break down old bone, and osteoblasts build new bone. In a healthy body, these two processes are balanced. However, when chronic inflammation sets in, the body produces an abundance of pro-inflammatory molecules called pro-inflammatory cytokines. These cytokines can excessively activate osteoclast activity, while simultaneously inhibiting osteoblast activity. The result is a net loss of bone, as bone destruction outpaces bone formation, leading to weaker and more fragile bones. Scientific evidence. Research published in journals like the Journal of Bone and Mineral Research has shown a direct link between levels of inflammation in the body and lower bone mineral density, as well as an increased risk of fractures in older adults. For instance, patients with rheumatoid arthritis often have a significantly higher risk of osteoporosis due to the persistent systemic inflammation. A real-life example. Consider the story of Ms. Ha. She had lived with irritable bowel syndrome (IBS) for many years but never thought it could impact her bones. Although she didn't have clear arthritis symptoms, routine blood tests showed higher than normal inflammation markers in her body. When she suffered a wrist fracture after a seemingly minor fall, doctors reviewed her full medical history and concluded that the chronic inflammation linked to her hips likely contributed to weakening her bones over time. Warning signs and self-protection. Signs of chronic inflammation can be vague, persistent fatigue, unexplained mild joint pain, digestive issues, or just a general feeling of being unwell. Questions you should ask your doctor and how you can protect yourself. If you have any chronic health conditions known to cause inflammation like autoimmune diseases, diabetes, obesity, periodontal disease, discuss their potential impact on your bone health with your doctor. Ask your doctor about simple blood tests that can help assess inflammation levels in your body. CRP reactive protein, S or erythrocyte sedimentation rate. Focus on an anti-inflammatory diet. Prioritize whole, unprocessed foods, plenty of fruits, vegetables, whole grains, omega-rich fatty fish, salmon, mackerel, nuts, and seeds. Limit refined sugars, processed foods, and hydrogenated vegetable oils. Manage stress. Chronic stress is also a driver of inflammation. Practice stress reduction techniques like meditation, yoga, deep breathing, or spending time on hobbies. Ensure adequate, quality sleep. Poor sleep can elevate inflammation levels. Regular moderate exercise. Physical activity in moderation helps to reduce inflammation and improve overall bone health. By managing chronic inflammation, you not only improve your overall health, but also protect your bones from a silent and dangerous adversary. Factor 5. Routine bone density scans leading to overtreatment. Finally, let's turn our attention to a test that seems perfectly smart and preventative. Bone density scans, also known as DEXA scans. This non-invasive test is quick and doesn't involve any needles or dyes. It sounds like the perfect preventive tool to assess your bone health, right? But here's what many people might not know. If you don't have clear symptoms or significant risk factors, frequent routine DEXA scans for an overly aggressive interpretation of results can lead you down a path to medical treatment you don't truly need, potentially with its own set of risks. Understanding DEXA scan results. A DEXA scan measures your bone mineral density by and provides two main values. T-score compares your bite to the average bite of a healthy young adult at peak bone mass, around age. A T-score of, or above, normal bone density. A T-score between, and osteopenia lower than normal bone density, but not yet osteoporosis. A T-score of, or below osteoporosis, low bone density, increased fracture risk. C-score compares your bite to the average bite of people your same age, gender, and ethnic background. A low Z-score can suggest a secondary cause for bone loss. The risks of overtreatment. The issue arises when a person has a T-score indicating osteopenia, but does not have other high-risk factors for fractures such as a previous fracture, family history of hip fracture, long-term corticosteroid use, smoking, excessive alcohol consumption, or chronic medical conditions affecting bones. In such cases, doctors might immediately recommend starting osteoporosis medications, most commonly bisphosphonates like Fosamax, Boniva, Actonol. While bisphosphonates can be effective in preventing fractures in individuals with severe osteoporosis, they also come with significant potential side effects. Digestive issues, nausea, diarrhea, abdominal pain, muscle, bone, or joint pain, rare but serious. Osteonecrosis of the jaw, a rare but severe condition that causes damage and death of jawbone tissue. Atypical femur fractures. Though rare, some individuals on long-term bisphosphonates may experience a fracture of the thigh bone in an atypical location, which can occur with very little or no trauma. A real-life example. Recall the story of Mr. Nam. He went for a routine checkup, and his doctor recommended a DEXA scan because he was over. The results showed mild osteopenia to score. Although he had no history of fractures and remained active, his doctor immediately prescribed bisphosphonates. After a few months on the medication, he began experiencing uncomfortable hip pain and mouth sores. After seeking a second opinion from another bone specialist, he was advised to discontinue the medication and focus on lifestyle, nutrition, and vitamin D supplementation. His joint pain significantly improved. Sir Nem shared, "I wish I had researched more before rushing into medication. Sometimes, doing nothing medically might have been safer and more effective if monitored correctly." Advice and self-protection. Don't panic just because of a low number. If your DEXA results show osteopenia, it doesn't necessarily mean you need immediate medication. This is the time to have a thorough discussion with your doctor. Comprehensive risk assessment. Ask your doctor about using the FracScore fracture risk assessment tool. This tool combines your T-score with your other risk factors: age, gender, family history, medication use, smoking, excessive alcohol, etc., to estimate your year risk of hip fracture or major osteoporotic fracture. This provides a much more holistic view than just a single T-score number. Always ask about lifestyle first. Ask, before medication, can we focus on lifestyle changes? A diet rich in calcium and vitamin D, regular weight-bearing exercise, quitting smoking, limiting alcohol, and stress management are the most crucial foundations for bone health. Seek a second opinion. If you are recommended osteoporosis medication, especially if you have no history of fractures or severe osteoporosis, consider seeking a second opinion from an endocrinologist, osteoporosis specialist, or geriatrician. Remember, the goal is to protect your bones safely and effectively, not to overtreat simply based on a number on a piece of paper. Conclusion: empowering your bone health journey. We've explored 5 critical factors you need to be aware of to protect your bones after. Let's recap what we've learned. Not every medication is harmless. Not every exercise routine is appropriate. Not every supplement is effective. And not every test leads to the right action. Our bodies respond differently as we age. What seems routine, like taking a common pill, pushing limits in exercise, or ignoring signs of inflammation, can have ripple effects we don't always see coming. A simple daily injection might spike your blood pressure. A scan might trigger a reaction. Even a quick checkup can carry risks if your system is already vulnerable. That's why it's so important to pause, ask questions, and ensure every bone health decision aligns with your body's unique needs, not just a general guideline or ingrained habit. You have every right to speak up, to ask, is this truly beneficial for my bones? To say, can we explore a safer alternative? Because informed decisions, based on knowledge and a deeper understanding of your own body, lead to better outcomes and peace of mind. Your health story matters. Your voice matters. And here at Longevity Secrets, we believe every choice should be guided by knowledge, not fear or habit. Bone health is the foundation for your independence, vitality, and quality of life in your golden years. By becoming a proactive, informed advocate for yourself, you can safeguard this foundation and enjoy a full, vibrant life. If you've ever felt something was off with your bone health, or witnessed a loved one go through an unexpected fracture, share your story by commenting with it below. If not, post a. Let's share, connect, and learn from each other's experiences. And if this video has helped you feel a little more aware, more in control, or just more curious about your bone health, hit that subscribe button to stay updated with vital insights from Longevity Secrets. We're here to uncover the truth, ask the hard questions, and always put your well-being first. Are you ready to become the architect of your own bone health?